As much as we can, and for as long as it can last, we help life go on. The Foundation for Home Care and Hospice offers a better life and even a better end of life for those in need of wheelchairs and medical equipment, home health services, and hospice care. In fact, every dollar donated helps bring a patient home.
I'm Mike, and this is my wife Mindy, and this is our daughter Presley, and she's 4, and this is Charlotte, and she's 1.
Presley has SMARD. It's spinal muscular atrophy with respiratory distress. And with that comes paralyzed diaphragm and muscle weakness. Presley was born a healthy baby girl. Everything was normal and fine, but when she was a few months old, we noticed her fingers were a little weak. We didn't think too much of it. It was when she was about 6 months old that we noticed her feet had stopped moving completely. And so we took her to a neurologist, and they explained that she probably had something neuromuscular, but they weren't sure what it was yet. And then at about 20 months old, she got RSV. After that event, she wasn't able to breathe on her own anymore or eat. She ended up getting her trach surgery and G-tube, and then she got scoliosis surgery, and she wasn't able to walk after that. When Presley was in the hospital and she had just gotten her scoliosis surgery, a member of the team at Intermountain Home Care had actually come up to the hospital and measured her for a loaner chair, and that was a huge blessing because we didn't have a wheelchair for her or anything. So, and then from there, we had already started to work with them, and that's when we started working with them to get her a power chair. So we went to the Intermountain Home Care wheelchair shop, and they had a team of people there with like a physical therapist, an occupational therapist to help fit her and see her specific needs, what she would need for her ventilator, to hold all her equipment, the kind of chair that she would be able to drive. Now she drives a power chair and breathes with her ventilator and eats with her G-tube, and yeah, is just the happiest little girl. Another thing is just that we're able to keep her at home. A lot of kids with like the amount of things they have that she has going on would be hospitalized the rest of their lives. So it really is like such a blessing to have them and to have people who actually care, because I feel like anytime we have called, you know, for food or the wheelchair shop or, you know, the respiratory therapist with her medical equipment, they really do care and get us the things that we need as soon as possible, and they're things that help keep her alive and healthy and happy.
They provide so many things for us. You know, without that, we wouldn't be able to give her the type of life that she has and that she needs and really that she deserves. So we're very grateful to Intermountain Home Care and for everything that they do. So.
We just really appreciate Intermountain Home Care and all the things that they've done for us. We really couldn't do it without them.
But you're forgetting me.
Paralysis is Presley's reality, but with a specialized power chair, Presley can move. With a respirator, she can breathe. For Cheryl, stricken with Lou Gehrig's disease, came the inevitable result, death. But hospice also came, clearing her path, easing her journey, and maximizing the time she had left.
Cheryl and I met at work. I was working on the inpatient unit at Primary Children's, and she was hired to be a psychology intern at what was at that time the Learning Problems Clinic. The really special part of Cheryl was her energy, her enthusiasm, her commitment to her work. She was there for a purpose. She was a wonderful person. She was a wonderful mother. I always felt lucky to have known her. I always felt lucky to, more than lucky, to have married her. We were on a family vacation with Cheryl's family in Newport Beach, and my son took off on his rollerblades down the boardwalk, and she went to chase him down on her rollerblades, and had a terrible fall. And really, since she was such an athletic person, it was sort of hard for any of us to understand what had gone on. After we returned home from that vacation, her motor skills just kept going downhill, and that progressed relatively quickly. Finally, our neurologist recommended that we go to see a specialist. Thankfully, we were able to get in and see this gentleman, and he ran a lot of tests and gave us the news that, in his opinion, Cheryl had ALS. It's commonly referred to as Lou Gehrig's disease, and it's a neuromuscular disease that attacks the large muscles. You hear the words and you don't want to think that they're real. Cheryl was able to be at home, and we had neighbors that were helping us. But as things progressed and her abilities and her strength became worse and worse, I really couldn't ask our neighbors anymore. I just thought it was time to look into our options. As a long-term employee of Intermountain, I've always known about the hospice service. I've always known it was out there. I've always heard good things about it. But everyone that came into the house was very positive, very professional, obviously cared about what they were doing, cared about us, and they became friends. I think overall, the greatest effect that it had on my family was it allowed us time. And it allowed us the time to be together. I'm a huge supporter of Intermountain's hospice. It's worth it. It's worth your time. It's worth your money. It's worth your efforts. It's worth your thoughts. It's worth your positive regard. The first reason being, they will be there for you if you need them. I'd just personally like to thank everyone that's been involved in any way in support of the September swing for Intermountain's hospice. Thank you.
There are thousands of Cheryls and Presleys among us, neighbors to us, and thousands of families emotionally and financially devastated. Our mission is to bring them comfort and care, regardless of ability to pay. Ours is a mission of the heart, hopefully to include your own. Your generosity can help make life livable in the darkest of hours. Your financial support allows Intermountain Home Care to deliver this care, even to those who can least afford it or may otherwise go without.